Hello everyone, I'm Dr. Viswanath, Aluru, attending physician in physical medicine and rehabilitation at Oxnard Health in New Orleans. In this video, we will continue with our topic, patient care. In the last video, we were discussing about discharge process, difference between a visit summary and a discharge summary, and so you have to remember the continuum of care process. That means you have to understand where the patient is going from your service to some other service, or the patient getting discharged home, or the patient getting discharged to some other facility like an LTAC facility, nursing home, or a skilled nursing facility, or some other facility, or going to acute care. So if the patient is going home, so especially if you're a rehab residency program, rehab resident, you need to understand like what important things that the patient needs, and what so it's important for the patient to continue with the rehab therapy. So it's always important to set up home therapy services, home nursing services, home wound care services, whatever things that they need when they go home. And also to explain to the patient that once they're done with the home nursing or home therapy, they should definitely be able to go to the outpatient therapy. So in certain situations, if the patient has good family support, and if you think that patient can go to outpatient therapy directly, which will benefit the patient more than starting off with a home therapy program, in that situation I would highly recommend that you encourage the patient and the family to choose or to prefer going to outpatient therapy rather than choosing home therapy. But it have to be evaluated on a case by case basis. Not everyone will be able to do that, but that's something that you will understand as the patient is progressing in therapy, to see how they are progressing or not. Sometimes if the patient is progressing, but if the patient still needs like intense therapy in an inpatient setting, then you might have to recommend sending the patient to a skilled nursing facility. You have to explain why you're sending the patient to skilled nursing, not sending the patient home. That means that might be a good option for that patient at that time in recovery process. So you have to kind of be able to examine the patient, be able to see how they're progressing, reaching their goals, like milestones, like short-term, long-term goals, and decide what is the ideal discharge plan for this patient. With this, I'm going to switch our gears to next topic, which is like a clinic. So as an intern or as a resident, you have the responsibility to go see the patients in the clinic also. It all depends on your service, the department you're attending, who you're following. Some attendings, they don't have any clinics, some have clinics. Their clinics might be 2 times a week or 3 times a week. They might be half day clinics, or they might be a full day clinic. Sometimes you might have to go to different clinics related to different services throughout the week. So, with the addition of clinic responsibility, your inpatient responsibility won't change. That means you still have to go on time, get your morning sign out, do your pre rounding, and do your rounding with your senior resident, and then go to your morning reports, and then do all the floor work, consults, progress notes, so all those things. But you have to be mindful, like if the clinic is starting at like 9:30, 10 o'clock, try to finish your notes, finish your floor work as much as possible, all the important things that you have to do before you go to clinic. Because when you go to clinic, it gets really busy, you will not have time to go back to your floor, see the purpose. So if there are any important things that you have to do first thing in the morning, like putting in important orders, putting in any consults, or putting in any discharge orders for any patient, discharging patients, those are the like the main things, or seeing like a sick patient. So once you take care of those important things first thing in the morning, then you go to the clinic. And sometimes you might find some time in between patients in the clinic. You still have to keep your pager on, keep answering the calls as soon as they come in, and then try to do some notes when you're in clinic in between, and try to do the orders from the clinic as much as possible. And sometimes the clinic end around 2 o'clock, 3 o'clock, then you go back to the floor and you do the rest of the work. In between, you might be consulted to see the patient on some other department, or in the emergency room, or if you're a surgery, you might have to go to pre-op area or a post-op area. You have to go to like OR to actually help your attending or a senior resident. So you still have to kind of do all these things. Sometimes it gets really crazy busy, especially when you're doing the clinics, and then you have the floor work, you have the consult service, all going in parallel. So you just have to find the best fit and try to divide your time in the best possible way, so you're not like involved in one thing all at a time. So that's in regards to the clinic. So clinics, mainly you will have like a new patient who comes to the clinic to see you for the first time, or a follow-up patient that you have already seen this patient. So you definitely need something like a clinic template. And so that's another way. You have to sit with your IT department to prepare your first time visit template and a follow-up visit template. Sometimes you have to do some clinic based procedures, you need like a procedure based template. So these are the three things that you need importantly. As you see the patient for the first time, you have to be thorough in terms of like why the patient is here, history of present illness, past medical history, surgical history, what medications the patient is taking, or any allergies, family history, review of systems, physical examination, like a general examination and a focused examination, and then vitals, any labs, pertinent imaging findings, and what's your assessment and plan, what you want to do for this patient. Are you ordering any new labs or new imaging for this patient? Are you sending any medications to the pharmacy? Which pharmacy you have to send these prescriptions? Are there any urgent prescription that you have to send immediately that the patient need to start right away? And those kind of things you have to be very thorough if it is a first time visit. It might take at least anywhere between 30 to 45 minutes if you're seeing like a new patient, and you have to write the notes and everything immediately. So in that way it's all entered in the computer. It's also sometimes very important that you understand, sometimes the patient come to the clinic, they don't know what's going on with them, and if you think there is something urgent issue that needs to be addressed immediately, like an inpatient, you have to transfer the patient to the emergency room. Sometimes attendings, they may or may not be able to admit the patient directly from the clinic to their service. In those situations, what they do is they ask the patient to go to the emergency room, and then you can check in, and then you can get the patient admitted to your service or some other service, depending on the acuity of the situation. But if the patient is coming back to see you, say if there are any follow-up labs or imaging that needs to be evaluated, and then only you can make a decision what thing you need to order for this patient in terms of like medication management or procedure management. Then you have to make sure the patient has a follow-up appointment like in next 2 days, 3 days. But if the patient, if you're already taken care of the first time visit, and then you ask the patient to come see me like in like 4 weeks, then it becomes a follow-up appointment. Then you don't have to go extensively into like history, physical, everything. You're now focused, you know what the problem was, and you took care of the problem, and you have to see how the patient is doing in terms of like medications or the problem management. So then you will write a progress note, type of note, like a follow-up visit clinic note, and it will be much shorter, more focused than like an initial visit note. But if you have performed any procedure, clinic procedures, then you have to use like in a procedure based template, and you should definitely get a consent before you do the procedure, and then you should include in the documentation that your consent has been taken. Then you should include all the preparation steps, and then you should include what you performed, and you should have a documentation related to your procedure and related to the consenting of the patient, what happened after the procedure, how did the procedure went, were there any complications related to the procedure, so those kind of things. So these are the main things related to your clinic. So with this I'm going to end this video. In the next video we will discuss about on-call responsibilities as an intern or a resident. I hope you find these videos useful and informative, and I will see you all in another video. Thank you.